Hey, so I've been living with glaucoma for over 15 years now. And one of the questions that I was asking myself was, why does glaucoma attack your side vision first as opposed to your central vision? Not sure if you had that question, but in today's video, we're going to get into just that. And we're going to talk about the test that we use to not only measure it, but to manage it right now. What's going on, everybody? Dr. Adesola Fadeyi here, and I specialize in sports vision training and glaucoma. And if it's your first time here on the page, thank you for pulling up. Consider being a part of the family, liking the video, subscribing, and sharing to somebody who you think might benefit from this, okay? In today's video, we'll get into why glaucoma attacks that side vision first as opposed to your central vision, how it all works, and the tests that we use to treat it. So the way I want you to look at it is like this. So you gotta think of the optic nerve like a bundle of 1,000 wires that are traveling from the eye to the brain. Those nerves don't enter randomly. The fibers that represent your side vision or your peripheral vision are arranged around the outer part of the optic nerve rim. And glaucoma damages the optic nerve right through that exit point called the lamina cribrosa. And what happens is that when the pressure of the eye is elevated or there's oxidative stress on that optic nerve, the outer part of the optic nerve tends to get damaged first around the outer rim, which is what actually attacks your side vision. Hence the reason why you lose your side vision first. And that's why glaucoma is really dangerous, because what's really going on is it's not that it's blurring your central vision, it's making your world smaller by slowly attacking and damaging that peripheral. And because your central vision comes from your macula, those macular fibers are more centrally located, which allows them to be a little bit more protected than those outer fibers that control your peripheral vision. And the crazy thing about it is that your brain is so smart that even though as glaucoma is progressing, it will still use your central vision to fill in all the gaps of the rest of the world. So you can still do things like reading and driving and playing sports and things like that completely unaffected, because it will fill in all those other gaps for you. So yes, while your brain is compensating for you, you still got both eyes working at the same time in tandem too, because of binocular summation, which is allowing both eyes to help fill in all the gaps that you're missing. So every single day you wake up in the morning, you look at yourself in the mirror and you have no idea that glaucoma is taking your world away. So what we'll tend to hear is some of my patients will come in and they'll say, hey doc, I keep bumping into stuff. I don't really see cars coming from the side anymore. I'm like miscalculating my steps when I go up and down the stairs. And my night driving seems a lot harder than it used to be in the past. And that's why in my mind, like when I hear those things, I just be like, oh, so this is why before we get to all those things, we like to make sure we really do thorough evaluations. And because when you have glaucoma, we can't rely on your central vision to measure that or to give us the status or the prognosis of your glaucoma. So we have to rely on your functionality of your side vision. Since that's what's attacked first, that's what we need to measure first. And the way that we do that is we use a machine called the Humphrey's visual field, specifically the 24-2 CETA standard. This machine maps out your side vision's sensitivity to stimuluses. So we're going to conduct this test to each eye individually. But what you're doing in the test is fairly simple. You'll put your chin in a chin rest, forehead against the top, and you're going to be inside of a globe where you're looking straight ahead at a target. And it's going to show you just different stimuluses in different areas of your side vision. And all you got to do is every time you see it, you just click the button. And it's going to do that for about 10 to 20 minutes, depending on the eye and on the person. And after that, it'll create a map that will show us the entire field and the depression of the field. It'll show us where your peripheral vision is strong and where it's weak. And we'll take that information based on normative data saying, hey, this is where normal, healthy people should be. And we'll compare and contrast, and that'll allow us to know how much damage is being done and where we need to start our treatment and our management from there. And how we manage glaucoma is that we repeat this test every 3 months or every 6 months, depending on the severity of your case. Now, although this test can be very accurate, reliability can also be an issue as well, because you can have false positives and false negatives because people want to click when they think they see it, when they're not really seeing it, or they're seeing it and then they're just not clicking. So sometimes we have to make sure that whoever's conducting the exam is educating the patient properly on how to successfully complete it. And when we create the map of your field after you're done doing the test, glaucoma has very specific patterns that it follows. And there's 4 that we normally see on average. The first one is a nasal step, okay, which is one of your first early signs of damage, okay? And it's like what it suggests. It kind of has this kind of step-like appearance that's towards the nasal side of the optic nerve. Now, the second defect that we see a lot of is what we call an arcuate defect, where we see this kind of curve-shaped depression on the visual field mapping, okay, which coincides to a RNFL loss, a retinal nerve fiber layer loss on the fundus exam, okay? Now, the thing is that whatever we see as the depression, okay, in the field loss, you're gonna see the opposite direction in the fundus exam, okay? It gets complicated, but everything that happens in the eyes is always opposite, okay? And inverted, okay? We'll talk about that on a later time. Now, the third type of defect that we'll see is when it's a little bit more advanced, and we'll start to see paracentral defects, okay, which is almost in the center, okay? It's it's around the center, okay? And this is when we start to see that those nerve fiber layers are starting to get attacked, not only from the outside now, okay? So it attacked the outside and it starts to work its way inside. And now we start to see the damage on the inside. So when we're testing you, you're actually starting to miss some of the central vision stimuluses that you're supposed to be catching. And that's when we know, like, okay, we're starting to get a little bit more advanced with your condition. And then the fourth and final one is just generalized depression, which just means that you're probably already getting towards the end stage of your glaucoma. Your side vision is already gone. Your central vision is going, and we're seeing pretty much all black on the field mapping. So at that point, it's almost closed curtain, and we need to start having other conversations moving forward. So ultimately, that's why this test is very important, because it allows us to catch damage before it gets worse and before you know it, and allows us to treat and manage it accordingly. And this is why, ladies and gentlemen, why glaucoma is called the silent thief of your sight, because it's going to attack that side vision first. You won't know. And then it starts to work its way towards the center. It starts to shrink your world altogether. And that's why it's important to maintain your follow-ups. It's important to maintain your eye drop regimen, okay? It's important to maintain these things, because all this will prevent you from going blind and your life being changed forever. And with that, guys, we're gonna go ahead and call it a wrap. So if you learned something from the video today, do me a favor, share this with somebody who you know needs to hear this, and who needs to maybe do a little bit better, okay? Ultimately, we're all in this together. I'm not just the doctor, I'm the patient as well. And that's why it's my duty to give back to y'all with this knowledge and this information. If there's any questions, leave it down in a comment. You already know I'm going to respond to every single one of them. And like I said, if you haven't been a part of the family, you got to consider joining. Man, we love to have you, so you're staying updated every time I drop content on the page, okay? But until the next one, y'all be blessed. As I always say, keep your vision clear. Peace.